Are new flu strains becoming more dangerous? Influenza, or the flu, is a common respiratory illness caused by influenza viruses that are constantly changing. These viruses evolve through a process called antigenic drift, which involves small genetic changes over time. Sometimes, more significant shifts happen, called antigenic shifts, which can lead to entirely new strains and potential pandemics. The question is whether these new strains are becoming more dangerous over time. The answer is complex and depends on many factors. Influenza viruses are mainly classified into types A, B, and C. Type A viruses are responsible for most seasonal flu outbreaks and all pandemics. They are further divided into subtypes based on surface proteins called hemagglutinin and neuraminidase. Because the virus's genetic material mutates frequently during replication, new strains appear regularly. This constant change is why the flu vaccine needs to be updated each year to match circulating strains. Looking at recent flu seasons, some have been more severe than others. For example, the 2024-2025 flu season in the United States saw a higher number of severe cases, especially among children. There were more pediatric deaths reported than in recent years, with some of the highest numbers since the 2009 H1N1 pandemic. This increased severity was linked to the circulating strains, ability to evade immunity, and the overall vulnerability of the population. However, not every new strain causes severe illness. Some strains lead to mild symptoms, while others can cause serious complications like pneumonia, hospitalization, or even death. Several factors influence how dangerous a new flu strain might be. Genetic mutations can affect how easily the virus spreads, how severe the illness is, and whether existing immunity from past infections or vaccines offers protection. Some strains are more transmissible, meaning they spread more quickly from person to person, increasing the number of cases. The virulence or severity of the virus also varies. Some strains are more likely to cause serious health issues. If a new strain is very different from previous ones, fewer people will have immunity, which can lead to wider outbreaks. Public health responses, including vaccination rates, availability of antiviral medications, and healthcare capacity, also play a crucial role in how the illness impacts society. Public health agencies like the Centers for Disease Control and Prevention and the World Health Organization closely monitor flu activity worldwide. They track circulating strains, assess their severity, and recommend updates to the flu vaccine accordingly. Getting vaccinated each year remains the most effective way to protect yourself from severe illness, hospitalization, and death. Antiviral medications can also help if taken early during infection. Following guidance from health authorities, practicing good hygiene, and staying up to date with vaccinations are key steps in reducing the spread of influenza. While some recent flu seasons have been more severe, this does not mean that all new strains are becoming inherently more dangerous. Influenza impact varies from year to year, and many factors influence severity. The scientific consensus is that influenza remains a significant public health concern, but the risk posed by new strains depends on their specific characteristics and the environment in which they circulate. Ongoing surveillance, vaccination efforts, and healthcare preparedness are essential tools in managing influenza risks. Always consult healthcare professionals for personalized advice and stay informed through reputable sources. The evolving nature of the flu means vigilance and science-based approaches are our best defenses against its unpredictable course.